As a first responder, I come in contact with many seniors and people with underlying medical conditions. As an asthmatic myself and the mother of an asthmatic daughter, I found that it was necessary to take the COVID vaccine. I believe that everyone should take the vaccine, especially our seniors, because the sooner everyone is vaccinated, the sooner we can return to some form of normalcy.
The Virgin Islands Department of Education is hiring.
My career as a chef and entrepreneur would not be possible without the incredible public school teachers who saw my potential and pushed me to excel.
My career in the Virgin Islands National Guard as an aviator began with great Virgin Islands public school teachers who exposed me to experiences that continue to impact my life today.
Public school educators change lives. We're looking for academic teachers, career and technical education teachers, paraprofessionals, and school nurses. Visit vide.vi/jobs to learn more about our careers. Join the VIDE team today.
You know, as a young child, I remember a public health nurse coming to my school to administer the polio vaccine. I simply trusted that the vaccine would protect me from serious illness. My life journey in public health has brought me to this time and place as Deputy Commissioner for Health Promotion and Disease Prevention at the Health Department. I got my COVID-19 vaccine from the amazing public health nurses at the Department of Health. And I encourage you to get yours too. Take your best shot against COVID-19. Get the vaccine.
Virgin Islanders at home and abroad. Welcome to the Government House Weekly Press Briefing and our COVID-19 update for the week of March 22nd, 2021. Joining me this afternoon is Dr. Esther Ellis, our epidemiologist on behalf of Health Commissioner Justa Encarnacion to provide the latest COVID-19 and vaccination numbers and information where persons can receive free COVID-19 testing in the territory this week. Dr. Ellis?
Good afternoon, everyone, and thank you, Commissioner Encarnacion and Governor Bryan, for the opportunity to update everyone on our current COVID numbers and speak more about the opportunity for vaccinations. In the past 10 days, from March 12th to today, there have been 91 new positives. That's 68 for St. Croix and 23 for St. Thomas, with 2,151 people tested. The 7-day percent positivity is 4%. As of this morning, Juan F. Louis Hospital and Medical Center reports 3 COVID-19 cases with 1 vented, and Schneider Regional Medical Center reports 1 COVID-19 patient that is also vented. We have completed 3 weeks of vaccinations at the Community Vaccination Centers, or CVCs, on St. Croix and St. Thomas, and our first Saturday community vaccination occurred on St. John. On Saturday from 8 to noon on St. John, we were able to vaccinate 155 individuals. Since opening on March 1st, we have administered 7,199 total vaccines at the CVCs alone, and today the CVC on St. Thomas reached 5,000 vaccinations administered and will exceed that number by the end of today. Congratulations to Mayra Pereira, who was the 5,000th St. Thomian to get the vaccine at our CVC today. 33,826 vaccines have been administered thus far. That's 30% of our eligible USVI population 16 and up with 1 vaccination dose, and 12.8% of our eligible USVI population 16 and up have completed the entire vaccine series. The territory is on track to meet or exceed the governor's goal of at least 50,000 vaccinations by July 1st. If you are interested in scheduling an appointment to get vaccinated, please call 340-777-8227, or you can schedule your own appointment online at covid19usvi.com /vaccines. Upcoming pop-up testing events this week: tomorrow, Tuesday, on St. Thomas at Home Depot, March 23rd, from 1 to 3 p.m. St. Thomas National Park Red Hook, Thursday, March 25th, from 1 to 3 p.m. St. Croix Canagata Rec Center, Tuesday, March 23rd.
Surge in COVID cases on the island of St. Croix. There is currently one COVID patient on a ventilator at JFL battling this virus, and I would like to take this opportunity and this time today to reiterate the importance of continuing to adhere to the guidelines issued by our local Department of Health. We still need to do the common sense things like wear your mask, practice social distancing, wash your hands frequently, and make sure you avoid gathering with people outside your immediate household. And yes, you can now inoculate yourself against the virus by joining the more than 33,000 Virgin Islands residents in getting vaccinated. Vaccinations are available to everyone age 16 and older at all of our vaccination centers in the territory. You can schedule your vaccination appointment online by visiting the Department of Health's website at covid19usvi.com/vaccines and clicking the Book Now tab, just like you do for a hotel, and by visiting Vitima's website, vitima.vi.gov, or by contacting the vaccination hotline, 777-VAX or 8227, if you do not have ready access to the internet. So we are making it as easy as possible for people to go out there and get your vaccine. And we are seeing instances where people are attending parties both here and in the territory and on the mainland, particularly in the state of Florida, that do not follow the guidelines of the Virgin Islands. And as a result, we are seeing that manifesting itself here in the Virgin Islands as an uptick as people coming back from their weekend. Just this weekend, the mayor of Miami Beach implemented an 8 p.m. curfew based on the poor judgment exercised by some people in that area. This is of particular concern to us here in the territory, as Miami is really a major travel hub for us. And I know a lot of you have been doing the weekend getaway thing into that, coming back into the territory. I'm urging you today, if you have recently visited this area, please do the right thing and make sure you get yourself tested and you isolate yourself for a couple of days so we can keep our community safe. We have been doing really well, and we have managed to strike that balance between protecting the public health, keeping our economy afloat, and allowing individuals to enjoy again some of the leisure of the pre-pandemic life. But we can easily lose our footing on that tightrope if we don't do the right thing, because we have been so successful thus far. There have been too many instances where residents frequenting areas that are either surging or still considered to be COVID hotspots have created a little problem here at home. In the past, people leaving the territory to attend events in the States have been the direct cause of outbreaks here. We can only implement testing protocols and other safety measures at our ports, and that is why we encourage Virgin Islanders to avoid unnecessary travel to the best extent as possible. If you do not need to travel at this time, please do not. I get it. It has been a long time. We have endured a year of strict protocols and changes to our social lives that no one enjoys. But if we could achieve community immunity through vaccination, we can get back to some of the social gatherings that we love and some of the other leisure of pre-pandemic life. I sit on my porch on Friday night and Saturday night at downtown Christiansted, and I could hear the pandemic knocking from every direction. And I see on TV, I monitor social media, and I see the parties and the people, whether here or on the mainland, people going to weddings and whatnot. You really have to be careful in these instances. And these are the most dangerous because you're going for 3-4 days. Even if you do the responsible thing and you get your test Saturday, you get your result Monday saying you're negative, you've still been out all day Saturday, Sunday, and Monday when you return to the territory. So please, if you're going to go away, just try to stay isolated for a couple days and make sure that you're okay. before you go back into the population, especially before you go visit mommy or anybody else. Please make sure that you are COVID safe. We are continuing to take and make progress on our stimulus payments to eligible Virgin Islanders residents. The Bureau of Internal Revenue and the Department of Finance this past Friday processed and mailed out about 6,985 stimulus checks totaling over $5 million. Some of you have been kind enough to hit me up on Instant Messenger and text and tell me, yeah, I got my check. That's great. I hope you spend it right here in the territory and contribute back into our economy, so you're stimulating Virgin Islanders and not Amazon.com or eBay. The $900 billion in coronavirus package that was passed in December 2020, or what we refer to as the second stimulus, update on that, we are still awaiting the $1,400 per person in stimulus funding payments from the American Rescue Plan, and we deliver those payments to those eligible residents once that money is received from the U.S. Treasury. In addition to the stimulus payments going out, we are also issuing an additional 6,425 income tax refunds totaling some $15 million, and that should go out later this week. So if you've been waiting for a tax check and you got your stimulus check, now you're going to get a tax check on top of it. Make sure, like I said, spend local. Those returns will go to filers that are due tax refunds for the year 2018. The Bureau has established a hotline to assist in responding to the volume of calls due to the stimulus checks and the tax checks inquiries. So if you have a question, 714-9325. That's 714-9325, and somebody there can answer it for you. It's a lot of work sending out all these checks. It's not as simple as just putting somebody's name and address on it. We have to verify income levels, verify people in the household, make sure you didn't get the check issued from some other places, because we've had that before, stateside issuance as well as Puerto Rico. And then we have to get those printed and we have to get them sent out. So stimulus checks, tax checks, we're trying to get them out as quickly as possible. I'd like to remind the public that the territories, unlike the U.S. Treasury, we have to issue the checks to our residents. In the states, they don't pay their taxes to their state internal revenue. They pay it to the federal government. We keep our taxes. That's why they're issued their tax check via direct deposit, and it goes out quickly. We, as the state now, unlike any other state, have to issue those checks ourselves, make sure that it's right, and get it out. More good news. We announced the opening of the Emergency Rental Assistance Program. That's next Monday, March 29th, to assist Virgin Islands families who have been delinquent or have fallen behind on their rent payments as a result of no action of their own, as a result of the coronavirus pandemic and the fallout that we're seeing. To qualify for those programs, your household must owe at least 1 month of rent or a utility bill. Remember, this is for your rent or utility, that's water, energy, whatever it is. If you owe 1 month for that, you also must prove that you have suffered loss of income as a result of COVID. Your unemployment check should suffice for that. I have one or more household members that are at risk of being homeless. So if you don't pay your rent, you're going to be homeless. You must exhibit that as well if you're going to have non-payment of rent. And finally, you have to have an annual income of at or below 80% of the area median income. Just as an example to you, a family of 4 living in St. Thomas, to qualify for this program, your income should be $53,700 or less. So when we say that, remember, this is not our rule. This is the federal government's rule. If it was up to me, I'd pay everybody's rent who's delinquent. But it doesn't work like that. You have to adhere to HUD regulations as they are issuing this money, and they're giving us the money to give to you and your landlord. This program does not, unfortunately, extend to individuals seeking assistance with the mortgage. There are other programs for that through the banks, Fannie Mae, and the forgiveness of mortgage or the reprogramming of your mortgage to allow for lower payments or payments stacked on to the back. More information on what's going on with rental assistance, vihfa.gov/ERAP, or Emergency Rental Assistance Program, ERAP, ERAP. You can also contact Housing directly, Housing Finance Authority, 24432 or 777-4432. In non-COVID related matters, and everything is related to COVID, I will be appearing before Congress this Wednesday, along with the governors of other insular territories, to provide testimony on way to help the territories improve their infrastructure in a sustainable economic manner. Under the President's forthcoming Build Back America infrastructure plan, we're hoping to get some ground there in bringing to the attention of the Congress, as well as the President, the struggle of all the territories that we're really going through now. All of these places under the U.S. flag that are guided by territory rules and regulation, that have the same financial problems, that have demographics of Black and brown people that do not have enough access to health care, do not have enough access to public assistance programs like SSI. We struggle under current taxation laws that discriminate against these territories. So when we give this testimony, it's always to talk about what can they do to help us as territories become more independent and sustainable. One of those things is helping us with Treasury in terms of being able to back our bonds and allow us to access the market at lower interest rates, supporting our Medicare option and allowing people to get access to health care here in the Virgin Islands. And of course, at all times, supporting any economic development programs in and around the Caribbean that we can be a part of that will fortify our area. I'm also meeting with U.S. Department of Education Secretary Miguel Cardona this week, along with my co-chair of the National Governors Association's Community Renewal Task Force. So this is a task force that I was put on by Governor Cuomo, and this is to actually address workforce development, career and technical education, early childhood education, and other priority issues impacting our state and local governments under the NGA's Community Renewal Agenda. Big part of that is broadband as well. You'll be hearing more about our broadband plans in the Virgin Islands and how we're expanding our broadband footprint to make sure that we not only reach our students, but our guests that come here as tourists, as well as our small business people. Like I said, our priorities here in meeting with the Secretary of Education is working towards a path that is built with the support of the federal government in education, as well as workforce development. Now, we recently were made aware of the return of cruise travel to the Caribbean through home ports in the Bahamas and in Barbados. This is welcoming news, but also raises the questions for many of our business people who have emailed and called me about when will we see cruise passengers return to the USVI. 2 weeks ago, we met virtually with all the cruise lines, Port Authority, WICO, Commissioner of Tourism as well, and I briefed them on our economic situation and what we were doing with COVID and our protocols that we have implemented and how they were working with us. Everyone was there, Disney, Royal Caribbean, all of the big names, including the Florida Caribbean Cruise Association leadership. The meeting was very cordial, but it was apparent that the principals of the cruise lines were not really optimistic about the return of cruise travel to our waters anytime soon. So we decided, or I decided, that I would take a more proactive approach to get the return of cruise passengers and their ships initiated. So we went about and we started to call and contact all 15 governors where we have cruise ports in the United States to get together and sign a petition, a letter to the President, encouraging the CDC, number one, to issue the rules and regulation for cruising from American ports, and also to ensure that they have a prospective date where we're going to have sailings from these ports in the U.S. on mainland. We've been waiting for these rules for over a year now, for just about a year now. Since the last, remember when they stopped cruise travel right around this time last year. So I'm in the process of securing the support of these 15 governors to make sure that we have a sail date. And we know that our vendors are feeling, and our businesses are feeling, and our taxis are feeling the crushing blow of not having cruise passengers for now almost a year, well, maybe a little more than a year. And we know that those states are also going through that. Last year, there was a talk about some $15 billion in 2 quarters alone of economic return that was lost in the Miami area as a result of cruise passengers being grounded. We would like to congratulate our Caribbean neighbors, Bahamas, Barbados, that are moving forward with cruise travel. I really want to acknowledge them on their courage in making a path for this to happen. And my heart goes out to a lot of our Eastern Caribbean sisters, islands. They've had an incredibly tough time with COVID. They have not had the benefit of quick vaccines, stimulus payments, payroll protections plans, unemployment insurance, teacher bonuses, all of the things that we have done, utility payments. Those islands don't have the benefit of that. And not only that, we've been able to remain relatively open when they have had to take a much more guarded approach to their COVID situation. And while it has helped them health-wise, it has severely damaged them financial-wise. You know, I want to see cruise passengers return, like a lot of my fellow leaders in the Caribbean. But the reality is that is a very scary proposition as well. And I really remain hopeful but anxious about the return of cruise travel to the Virgin Islands. That's why we need to ramp up on these vaccines. And I think this is a great opportunity for us because we'll be paying attention to what happens with the cruise travel with them, offloading 1,000, 2,000, 3,000 people into their economy each day. Certainly a tenuous situation, but we wish them all the best, and we'll be paying attention to make sure that we make our protocols better by identifying what happened there. We've had our protocols for cruising in draft form from December of last year. However, we can't finalize them until the CDC makes the move to issue the guidelines, and then we will have it complete. You know, we are less than a week away from our extended Easter holiday weekend. And like clockwork, after every single big weekend, we see this surge. This is why last week in St. Croix, we had health go out and issue this alert about the rising number of active COVID cases on this particular island. St. Croix was doing good, but we have too many cases being reported in the last week. And while 4% is under the 5% infection rate that is optimal, we like ours at 2.5% or less. And we don't want to have to go through any shutdowns or anything like that. So we're asking people to be especially guarded for this upcoming Easter weekend. I know everybody's stressed and they're tired of the COVID, but I just want you to make sure that if you're going to go out, please adhere to the guidelines. The Department of Health doesn't put these things out for giggles. They really want us to be safe. Under this public health state of emergency, you know already there was no camping this year. We restricted that. And, you know, it hurts me too. I go camping every year. I can't go. But you can enjoy the beach till 5. And if you're going to go on the beach, remember, please don't take the DJ and the boombox and the barbecue grill and everything else. We want to keep people safe. You know, try to get small groups of people, vaccinated people, together and maybe do something on a less smaller scale. And make sure you keep your family safe for the weekend, the Easter weekend. I want you to remind you that together, our team and you have been able to remain diligent and get through this COVID. You know, this morning as I watched the news, I was watching Brazil, which is now raging again. They have they have a quarter of all the positive cases in the world today. And that's frightening. And there are all kinds of variants of this disease that's going around. So let's not be a victim. Let's not bring it into our community. Let's make sure that with social distancing, we get off of the beach by 5. We try to make sure that we keep people safe by even telling them about wearing their masks, washing their hands, and make sure if you have to do something, do it outdoors, get a little air in a space, not a crowd. Please, if you have the time this weekend, de-stress inside. Finish reading the book you wanted. Finish painting the house. Get those plants planted for spring and the rain that we hope to see and enjoy soon. But whatever you do and whatever you decide to do, please make sure that you're doing it with the well-being of your family and your friends first, but also us, the larger community in mind. And to you out there, if you're expecting a spouse, girlfriend, cousin, auntie, whoever back from Miami or Orlando this weekend, lock them in the room, please, and spray them with Lysol. I'll take some questions from the press now.
Hello, good afternoon.
Good afternoon, Lasiba.
Awesome. Lasiba Knight from the St. Gravis. So my first couple questions are for you, Dr. Ellis. How far out is the territory from being able to just completely rescind all COVID-19 restrictions, you know, given our rising vaccination rate? What are the steps, the final few steps that you see necessary, or like a date or a concrete timeline if you have one?
Okay, yeah, thank you for that question. It's really hard to say. We'll know when we get there, is I guess the short answer. But you know, we've had so far 33,826 vaccinations have been administered. That's one dose only for some of the population. So one dose of Pfizer and Moderna protects you. 2 weeks after that one dose, about 75%. And then 2 weeks after your second dose, you're up to 95% protected. We'll know, when I say we'll know when we get there, is once we reach herd immunity, we'll start to see a dip in our new case count. We'll also see a dip in our percent positivity. So we are looking at the data every day to see if we're there yet. It would probably be about 60% of our population to reach herd immunity. That's an estimate.
I mean, I think that's a better question for me to answer, because really the statistics are just the statistics. I will be the one who will have to make the decision. I'm optimistic about Festival 21 in St. Croix. The problem is, as we continue to see more and more variants enter the scene, we have to see how our vaccination will go. But I figure, I had estimated that by June, you would see our positivity rate move down to about 1%, and you would see more restrictions being eased. I'd actually hope to let some of those go for April, but with the upcoming Easter weekend and what we're seeing, we just want to get above 30,000 shots. So right now we have administered 33,000 vaccines, but approximately about 10,000 of those are second shots. So there's only 23,000 unique individual or thereabout who have been vaccinated with one shot or two.
Yep.
Okay.
So that's the barometer. Let's get that individual one to 30, and then we could start to talk about easing some restrictions.
And I know we're aiming for 50,000 residents vaccinated. I'm just wondering if the department is taking vaccine tourism into account when they're reporting the number of residents vaccinated, because tourism is pretty hot right now. And, you know, I myself know people who have come into the territory specifically to get the vaccine and then leave. And, you know, that's no issue really. But when we're talking about residents vaccinated, I'm wondering if that's being taken into account.
I think we take that into account in terms of One of the things that I noted when Dr. Ellis has a very, very nice a sheet that shows you different statistics, and one thing I noticed, there's a higher percentage of Caucasians proportionately taking the vaccine than we have in our community. That could mean two things. It could mean we could have some vaccine tourism, but more likely it means that the Caucasians that live in the Virgin Islands are more apt to take the vaccine and take it quicker. So that may account for that. Our real concern is not if we're getting vaccination tourism. Our real concern is, do we have enough vaccines for everybody? We're seeing like 90 to 100 walk-ins each island per day. And we're able to serve them. There's no line there. So as long as we're able to do that, that will not be as much of a concern to us. If we had to probably give it a number, I doubt it would pass 3%. But our job is to get shots in arms. Just take your best shot. And everybody we meet who we should be encouraging them to go down and get the vaccine, because it is sort of like a privilege now, because nowhere else in the U.S. Can you actually just walk in and get a vaccine, anybody over 16. So we need to take advantage of that.
Awesome. And then, Governor, one final question. A few weeks ago when we spoke about the emergency rental program, one thing that you were excited about hopefully bringing online with the program is an online portal so that people can register for it and not have to crowd offices and whatnot. In the literature announcing it, I didn't see, and I maybe missed, but I'm wondering, is that online portal coming online with the with the program or not?
Absolutely. One of the delays, the biggest delay in the program, is that we can't get the software up to speed and get the online portal, because yes, we don't want people coming into offices to do that. It's a lot of documentation, so that's going to be a piece of it for sure. E-Governor all the way.
Awesome. Thank you very much, guys.
Thank you, Lasiba. Thank you. We don't have any more questions today. I just want to say, everybody, have a great week. We have an extra long weekend for Easter because our transfer day is on Wednesday, at least those of you who work for the government. So start planning from now how you're going to have a safe holiday, and we're going to be back here with no surges, St. Thomas, St. John, or no St. Croix. In the meantime, stay safe, stay sanitized. Love you. Have a great day.